We have two sets of veins in our legs. The veins that run right under the skin, like the veins that we have under the skin in our arms, and the veins that run deep between the muscles. We call them deep veins. In the deep veins, obviously, we can have a DVT or deep vein thrombosis, a clot that forms in the veins deep between the muscles. Sometimes we don't recognize this, or sometimes it could be just a little bit of a swelling after a long walk or a hike or a long plane ride. The triad of inactivity, thick blood, and or trauma to the vessels, and or surgical conditions such as a knee replacement or hip replacement can put us at risk for having a blood clot in our legs. So right after the clot forms, we have this acute inflammatory phase where the leg swells up, there is redness and pain and tenderness, but people may not notice it, only to deal with the consequences of this blood clot, which is called post-thrombotic syndrome. And as we get older and as we age, this becomes more manifest with swelling of the leg after any prolonged standing more than a couple of hours. Gradually we'll have spider veins showing up, varicose veins showing up because the blood cannot go through the normal path and has to find an accessory path, which is usually these veins under the skin, and they show up as varicose veins. Another condition that can happen with deep veins is called May-Thurner syndrome. This is not so much a plaque buildup, but rather a feature of our anatomy where the right iliac artery crosses over the veins draining the legs, specifically the left iliac vein and also the right iliac vein. The treatment for May-Thurner, on the other hand, involves a detailed intravascular ultrasound, or IVUS. The IVUS catheter is inserted into the vein and looks at the vein from inside out to see the size of the vein for one thing, and then to assess the degree of compression. How much of a compression is this artery causing on the vein? And based on that, the treatment involves placing a stent to prevent this compression. As far as the superficial veins are concerned, treatment involves treating what we call truncal veins. These are the veins that course along what we call the subcutaneous fascia, or the soft tissue right under the skin from the ankle all the way up to the groin. The treatment for these veins is basically to take them out of the circulation. For the majority of patients, we can safely do this by placing a catheter and delivering the treatment through the catheter. This catheter is either hooked up to a radiofrequency source of energy or is connected to a glue gun if we choose to use that specific way of treatment. And with each squeeze of the trigger, we deliver a certain small amount or aliquot of the glue along the course of the vein as we pull the catheter back. The idea behind both methods, and sometimes even laser, is to basically collapse the vein that is large, varicose, has valves in it that are not competent.